So you had a mammogram, and then you get a call saying the doctor saw something suspicious. You may have had additional testing like an ultrasound or an MRI. Finally, you had a biopsy, and it came back positive for cancer. What happens now? I'll tell you what to expect when you get this new diagnosis. Hello, and welcome to the Wealth of Wellness. I'm Ami, your cancer coach. I am a two-time cancer survivor and worked as a PA in oncology fields for 9 years. This video will give you some general information on what to expect after you have a new diagnosis of breast cancer. Remember, this is not medical advice. Please check with your doctor for any questions relating to your particular situation. The first step is to remain calm, and I know that sounds impossible and crazy. Stress and anxiety will be high during this time. Do whatever you can to reduce your stress. Whether it's journaling or deep breathing exercises, try something to calm you down. Now, you will have to take it one day at a time. Ask your doctor about any questions you have. Join a support group so you can talk to others going through similar experiences. You want to be an active participant in your treatment plan. Ask about the different types of treatment available. Options may include surgery, chemotherapy, hormone blockers, or radiation treatment. The type of treatment and the order of the treatments may vary based on the cancer you have. Ask about side effects or potential complications of any of the treatments planned for you. You will need to eat healthy foods like lean proteins, fruits, vegetables, whole grains, and healthy fats to help your body heal, make new tissues, and repair the damaged ones. Make sure to drink plenty of water and stay hydrated during treatments. If you currently exercise, keep it up until your treatments start. If you don't currently exercise, now would be a great time to try some gentle yoga. This can also help calm your nerves. After your surgery and other treatments, you will need time to heal, so you won't be doing much exercise. After your treatments are complete, your doctor may recommend working with a physical therapist. When you are cleared by your doctor to begin exercising again, start slow and gradually increase the type of activity you do. Your body will need plenty of extra rest and sleep after any of these treatments. Your body heals when you sleep, so keep your social and work calendars as light as you can. Use this downtime to journal, read, or take up a hobby like jigsaw puzzles or knitting. Nap when you need to. Here are some additional tips to help you. Before having surgery or starting chemotherapy or radiation treatments, make sure to do the following. Number 1, gather all the essentials you may need after treatments. Things like extra pillows, blankets, a water bottle, warm socks, preferably with the grips on the bottom, pain medications, and a book to read. Number 2, set up an area where you can sit and rest at home. Keep a table nearby for water, pain medications, and a book. Number 3, ask for help. Arrange for childcare if needed. Hire someone to help you with the household chores for a few weeks. Remember, you will need someone to drive you home after surgery. Number 4, meal prep. Cook and freeze meals ahead of time or stock up on easy to prepare meals so you don't have to cook. Another option is to have your family, friends, or local community form a meal train for you. Number 5, fill any prescriptions your doctor has given you before surgery. Make sure you have over-the-counter pain medications at home. Keep a list of all your medications and allergies for the hospital staff. Okay, here are some tips if you're going to be having surgery. After your surgery, number 1, wear loose, comfortable clothing that opens in the front. This includes shirts, bras, and pajamas. Get mastectomy bras that are easy to open and have a place to keep your drains. Ask your surgeon or hospital if they provide any. Number 2, you will need time to rest and recover. Follow your doctor's instructions. You probably won't be able to drive or lift more than 10 pounds for a few weeks. Get help from others in the house, whether it's your spouse, family, friends, or hired help. Number 3, practice the deep breathing exercises if recommended by your surgical team. Number 4, take all medications as prescribed. Number 5, keep the surgical area clean and dry. Follow your doctor's instructions on changing dressings and caring for your drains. Number 6, schedule and keep all your follow-up appointments. If you will be having chemotherapy, here are some questions to ask. Number 1, ask the nurses about cold caps or cold mittens to help reduce side effects. Number 2, are there any food restrictions while you are getting treatments? Number 3, what are the expected side effects from your medications, including both the pre-medications and the chemotherapy? Number 4, know your treatment schedule and book it on your calendar. After your chemotherapy, you will need time to rest and recover. Don't try to do too much after chemo. Sleep or nap if you need to. Tell your doctor of any side effects you are feeling. Another thing to do is to protect yourself when you're out of the house. Wear a face mask or avoid large crowds when your blood counts are low. This will lower your risk of getting sick. Remember to wash your hands when you come back home. Finally, here are some tips if you will be starting radiation therapy. Number 1, you may have a treatment planning CAT scan, and they might place tiny tattoos in your skin. These are markers to make sure they are treating the right area every day. Number 2, radiation treatments are usually given Monday to Friday. Make sure you know your treatment dates and mark them on your calendar. Number 3, ask your nurses which lotions and deodorants are okay to use. Number 4, do not apply anything on the skin before your treatments. Finally, after your radiation treatments, you want to apply any moisturizers that the radiation team tells you are okay to use. Number 2, you want to stay hydrated. Number 3, you may feel tired or fatigued, so make sure to rest or nap if you need to. Number 4, try to avoid excess sun exposure to the area being treated. I hope this information was helpful. I have created a free guide that will also help you during your treatments. The link to get it is in the description box below. If you need additional support, book a free call with me, and I can answer any other questions you may have. Again, the link to book a call is in the description box below. I also offer a coaching program made just for you. I have a self-study course, a small group program, and individual coaching to help you optimize your health during cancer treatments. Send me an email or a DM on social media and let's get to know each other. I wish you all the best during this tough time, and I will see you in the next video.